Hi there. Welcome to Animate 1D. My name is Lisa. I am a diabetes educator and also have type 1.
My name is Matt. I am a diabetes educator also.
My name is Dr. Shruti Ahuja. I am a pediatric endocrinologist.
My name is Dr. Brian Snyder. I am an adult endocrinologist.
My name is Kelsey, and I am a mental health counselor. In this video, we learn about different forms of disordered eating behaviors and discuss when to reach out for support from a mental health provider. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Hello, everyone. I'm excited that Kelsey will be helping us learn more about eating disorders today.
Thanks, Dr. Snyder. I'm glad to be here too. Disordered eating is a serious mental health concern and can have negative effects on type 1 diabetes, so it's important that we learn more about the signs and ways to help. In our discussion today, I will provide some basic information about types of eating disorders and disordered eating behaviors as well as how they can affect diabetes. You are all encouraged to ask questions and share your insights too.
What's the difference between an eating disorder and disordered eating?
Disordered eating refers to the harmful behaviors related to eating that somebody uses to influence their weight in an unhealthy way. Eating disorders refer to the mental health conditions that an individual may be diagnosed with if engaging in disordered eating consistently over a specific period of time.
Oh, so disordered eating is less severe than an eating disorder?
I like to think of eating behaviors on a spectrum from typical or healthy eating behaviors to eating disorders. Disordered eating falls somewhere in between and can range in frequency and severity. When disordered eating behaviors increase and cause significant distress and health complications, it is likely that an eating disorder is present. Both are very serious health concerns and can complicate diabetes management, so different levels of support may be warranted.
It is good to recognize the difference so that the right type of treatment can be offered. Let's talk more about the specific types of eating disorders.
There are several types of eating disorders. Let's start with anorexia nervosa. Anorexia nervosa is an eating disorder that is characterized by restricting energy intake that results in significantly low body weight for somebody's age, gender, height, and development. People with anorexia experience an intense fear of gaining weight and often engage in behaviors that prevent weight gain, like eating irregularly or purging.
What is purging?
Purging happens when somebody self-induces vomiting or uses laxatives, diuretics, or medication to cause excessive bowel movements to get rid of food after it's been eaten. People with anorexia also experience hyperfocus on body image with a particularly negative perception of their body, which fuels the food restriction and purging. Oftentimes, people with anorexia lack an understanding of just how serious their current low body weight is, which contributes to the use of disordered eating behaviors.
Does the actual weight of a person have any role in the diagnosis of anorexia?
Yes, body mass index, or somebody's BMI, is used to determine the severity level of anorexia. The lower the BMI, the greater the severity.
Beyond these symptoms, are there other signs that somebody may be experiencing anorexia?
Sometimes, people may engage in disordered eating behaviors in private, or not know that these behaviors are considered disordered eating. Other than rapid weight loss, some signs of anorexia could include constipation, abdominal pain, cold intolerance, and feeling lethargic or having excess energy. For females, amenorrhea, or the loss of menstrual periods not caused by birth control or pregnancy, can occur during anorexia.
Are there eating disorders that involve eating too much food?
Yes. Binge eating disorder refers to repeated episodes of eating a large amount of food during a discrete period of time, something that we call a binge eating episode. People feel a lack of control when eating during the binge episode. They also tend to eat faster than usual, eat until they feel uncomfortably full, and eat large amounts of food even if not physically hungry. People will often eat alone due to feeling embarrassed by the amount of food that's being consumed, and struggle with negative feelings like distress during the binge, and disgust, guilt, or sadness afterwards.
Is the severity of binge eating disorder also based on weight?
No. The severity of binge eating disorder is based on the number of binges that happen during a week, and that more frequent binges indicate more severity. The last eating disorder I'm going to share about today is called bulimia, which involves repeated binge eating episodes that are followed by behaviors that are intended to compensate for the calories consumed during the binge. Compensatory behaviors could include excessive purging, fasting, or exercise. Somebody with bulimia may struggle with self-worth and low self-views due to their weight. Severity of bulimia is also based on the number of binges per week, with more binges indicating greater severity of the condition.
I've heard a bit about diabulimia. What exactly is that?
Diabulimia is not a diagnosable condition, rather it is a term used in the medical community to describe the behavior of restricting insulin to intentionally create ketones in order to promote rapid weight loss. This would be considered a type of purging behavior that is unique to people with type 1 diabetes.
What are some other examples of disordered eating behaviors?
As a reminder, eating behaviors range on a spectrum from typical and healthy behaviors to eating disorders. In the middle are the disordered eating behaviors. This means that somebody can engage in disordered eating behaviors, but it's not quite at the level that indicates a diagnosed eating disorder.
Thanks for the reminder.
Sure thing. So a lot of what we have already talked about also applies to disordered eating. Restriction, like skipping meals or eating very limited calories; purging, like self-induced vomiting or bowel movements through use of medications, laxatives, or diuretics; and binge eating very large amounts of food in a short period of time are all disordered eating behaviors.
What about dieting or omitting specific food groups? Would either of those be considered disordered eating behaviors?
It depends on the intention of the behavior, the frequency it occurs, and the impacts it has on somebody. By itself, following a particular diet can be helpful for anyone, especially in the context of diabetes, and omitting specific food groups due to allergies or sensitivities can also be necessary for somebody. If the intention is to rapidly lose weight to a point where weight is at a very low, unhealthy level, coupled with fear of weight gain and persistent difficulties with body image, then the behaviors are more concerning and it's really important to reach out for support.
I now understand the difference between disordered eating and eating disorders, and how they are related. Can you tell us a little about how this can impact type 1 diabetes?
Absolutely. Research has found that both disordered eating and eating disorders are associated with worse glycemic control and earlier onset of microvascular complications like retinopathy, nephropathy, and neuropathy. When restricting insulin, there is an increased risk of diabetic ketoacidosis. If disordered eating behaviors are left untreated, they tend to increase in frequency and intensity, posing more threats to health that can be fatal.
How can we best support our patients who may be struggling with disordered eating?
If you are concerned about possible disordered eating behaviors, approach the subject from a place of compassion and non-judgment. This can sometimes be a difficult topic for people to disclose, and there is often a lot of guilt and shame associated with body image and disordered eating. Luckily, there are great options for treatment. A multidisciplinary treatment approach to disordered eating is recommended, especially for people with type 1 diabetes.
Who all should be included for multidisciplinary treatment?
Medical providers who are helping the patient manage diabetes, like an endocrinologist and primary care physician, should be involved to help monitor changes in diabetes and prescribe medications as needed. A mental health provider with a background in eating disorder treatment is crucial to provide psychotherapy for the patient. Depending on the severity level of disordered eating, there are different psychotherapies that can be used in different settings.
What kinds of things would happen in psychotherapy?
People will learn and practice skills related to identifying the thoughts and emotions that underlie some of the disordered eating behaviors. Increasing self-awareness of behaviors and restoring healthy, more adaptive eating behaviors is a big part of it too. The development of coping strategies to support recovery, such as mindfulness and embodiment practices, can also occur.
Are there other healthcare providers usually involved in the multidisciplinary team?
Yes. Collaboration with registered dietitians or nutritionists can be helpful to monitor food intake and weight, as well as make sustainable eating plans. Additionally, vitamins and supplements may be medically necessary in recovery, so these providers can share information about those resources.
Each provider has such a valuable role in working together to support the health and recovery of the patient.
Eating behaviors can range on a spectrum from healthy and adaptive to eating disorders. When people experience disordered eating, they are engaging in harmful eating behaviors that are not sustainable over time for optimal health and wellness. Disordered eating behaviors can include binging, which is eating a very large amount in a short period of time; purging, which is intentionally eliminating the food that was recently consumed; and restricting, which is excessively limiting the intake of food or calories. If disordered eating behaviors are consistent and coupled with difficult thoughts and emotions, an eating disorder may be present. Diagnosable eating disorders include anorexia nervosa, which is characterized by food restriction, purging, and fear of weight gain so much that somebody's BMI is below healthy levels, binge eating disorder, which involves consistent binge eating episodes, and bulimia nervosa, which is characterized by a vicious cycle of binging and purging. Eating disorders can occur at any age for anyone, but the risk of onset is highest during adolescence and early adulthood, with females having higher prevalence rates than males. Disordered eating complicates type 1 diabetes management and increases complications from the condition. People with type 1 diabetes experience higher prevalence rates of disordered eating compared to peers without type 1 diabetes. There is no single cause of eating disorders. Although, some risk factors have been identified, including temperament, environmental influences on body image and weight, and genetic components, like a family history of disordered eating, or physiological differences in neural pathways for reward centers in the brain. Any type of disordered eating poses a major health risk to individuals, especially when they also have type 1 diabetes due to the intricate nature of blood sugar management. If you or somebody you know is engaging in possibly disordered eating behaviors, please seek support from a healthcare provider who can get you connected with the necessary resources.
Thanks so much for helping us understand more about disordered eating behaviors and the different types of eating disorders, Kelsey.
I appreciated learning about the value of collaboration with providers on a multidisciplinary team.
I'm glad to know that there are effective treatments available.
Agreed. And this has also taught me about the usefulness of screening for disordered eating.
Yes, screening is critical for early detection and treatment intervention to improve health outcomes and quality of life. We can all play a valuable role to support people struggling with disordered eating. Through this playlist, we will learn what mental health is, common mental health challenges that people with diabetes experience, and strategies to support mental well-being. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team. To learn more, check out the resources in the video notes.
Don't forget to like and subscribe to our channel. Thank you.